hematology, oncology, pharmacology, antimetabolites. All right, so for the antimetabolites, this is probably one of the most important high yield aspects, especially for your hematology oncology course that you're going to be taking in the summer. But I'm just going to once again go over the highest yield things that you need to know for step one in order to feel comfortable with your hematology oncology pharmacology section. So for all antimetabolites, these are all S phase specific. Okay, cladribine is the only one that's not, but everything else is S phase specific. Okay, so everything that they do, they're inhibiting the S phase of the cell cycle. Okay. So what type of drugs are in there? We have the thiopurines, which is AZA, okay, which is also known as azathioprine, or 6-MP, 6-mercaptopurine, okay? Next, cladribine, okay? And then moving forward, we have 5-FU, which is 5-fluorouracil. We have hydroxyurea. And lastly, we have methotrexate, okay? So let's begin with the thiopurines. AZA and 6-MP, all these are purine analogs. So if I were to give you something that's a purine analog, okay, that means I'm going to block the original purines from being made. And why are purines important to be made? Because we need them for DNA synthesis at the end of the day. So if I give you a purine analog, my body is going to think, at the end of the day that I have so many purines available, so I'm not going to make any more. And with that being the case, it leads to a decrease of purine synthesis overall in my body, okay? So AZA is converted to an active form known as 6-MP, which is then activated by HGPRT. Okay, that whole process is important for understanding that this is just purine analogs. Okay, so it starts with 6-MP, it starts with AZA, then it goes to 6-MP, and then it's converted into its active purine form analog via HGPRT. Okay, now the only thing that I really care about that you should somewhat know is that 6-MP is inactivated by xanthine oxidase. So when we talk about our gout drugs like allopurinol or febuxostat, we're going to lead to an increase in toxicity when we give them this, because if we don't have, so allopurinol and febuxostat, this is just a small side note, what they do is that they inhibit xanthine oxidase. Well, if 6-MP is inactivated by xanthine oxidase, and I'm also taking a drug that inactivates xanthine oxidase, then I no longer have that inhibition for 6-MP. So 6-MP levels build up in my blood and they lead to extra toxicity. So be careful of that. Okay. Moving on to cladribine. Cladribine is purine analog. Okay. Once again, it's interfering with that DNA synthesis. Has nothing to do. It's going to be specific in that S phase because it's about the synthesis of DNA production, right? And what you need to know is its clinical use is for hairy cell leukemia. Very easy, quick and easy. Moving forward, 5-FU. 5-FU is, what you need to understand about this is that it's going to use thymidylate synthase inhibition. That's its mechanism of action. It's going to inhibit thymidylate synthase. Okay? And that leads to an overall decrease in DNA synthesis. Now, to see the overall picture, you're going to have to look up the graph online or kind of understand it further via sketchy videos. But for our purposes here, understand and remember that 5-FU inhibits thymidylate synthase, which leads to just an overall decrease in DNA synthesis. Okay? And what we need to understand is that these effects are enhanced with the addition of leucovorin. Okay, we'll see another medication like methotrexate. We can reverse the adverse effects with leucovorin, but if we give leucovorin to patients that take 5-FU, then we're going to actually enhance the effects of 5-FU. Okay, the adverse effects: hand-foot syndrome, diarrhea, and photosensitivity. Okay, hydroxyurea. Hydroxyurea inhibits ribonucleotide reductase, leading to decreased DNA synthesis. Now, you might be asking me the question, wait, I already heard about hydroxyurea. Yeah, we already talked about it via the usage for pharmacological usage for sickle cell disease in patients that were just born with it, because it keeps, hemoglobin, fetal hemoglobin available even after birth. Okay, so that's where we use hydroxyurea, but we can also use it for, any type of cancers, but it's not important to know. So it inhibits ribonucleotide reductase, decreases DNA synthesis overall, okay? And you can use it for sickle cell disease, leading to HbF increase, okay? Now, what you have to understand is that the adverse effect can lead to megaloblastic anemia, okay? Lastly is methotrexate, MTX. MTX is probably one of the most high yield medications that they're going to be asking about, even though all of these aren't as high yield as we think. This is a folic acid analog. So just how the purine analogs affect, we have methotrexate affecting folic acid production, okay, and take-up. It competitively inhibits dihydrofolate reductase, which leads to a decrease in DNA synthesis. So remember, it's a folic acid analog that leads to competition of inhibiting dihydrofolate reductase, okay? Now, it can be used for cancers, hence the reason we're talking about it now. But what they like to ask about is using it for ectopic pregnancies and abortion, okay? And we're going to be talking more about that specifically when we get to our repro section because it is important. Now, you can have myelosuppression as your adverse effect, just like everything else, but we can give you a rescue therapy known as leucovorin. So leucovorin, provided with methotrexate, inhibits methotrexate, okay? So it decreases your adverse effects of methotrexate if you give leucovorin. If you give leucovorin, once again, with 5-FU, you're going to enhance the effects of 5-FU. So be careful, make sure to differentiate. Okay. But overall, those are the high yield things that you need to know. Remember that all these are S-phase specific except for cladribine. And just remember those mechanisms of action. If you need a full table of understanding what's going on with the dihydrofolate reductase, as well as the thymidylate synthase pathway, just look it up online. A very easy schematic view is going to be helpful. Okay.